Hello, acute cough is a common complaint in children, especially in autumn and winter. The most common causes are viruses, then allergies, then bacteria. We can treat mild to moderate coughs at home by giving symptomatic treatment if there is no chronic illness and no history of allergy or recurrent nebulizations. By giving plenty of fluids, bed rest, nasal cleaning, and temperature control, we can use complementary and alternative medicine after checking their safety. You can check with your doctor, like using honey, for example. You can use decongestant and medicine that decrease nasal secretions after discussing the safety of those medicine and how to properly using them. Do not give cough syrups below age 4 years because of their side effects, and if you use them after age 4 years, use them judiciously to avoid complications, and take care to judiciously use antibiotic. When to seek medical advice: if there is high body temperature, axillary body temperature above 38 degrees Celsius, if there is rapid or difficulty breathing, severe coughing, the child is unable to speak, unable to play, or unable to eat, if there is family concern, or if there is chronic illness or history of recurrent nebulizations.